Today's question is: a 56-year-old man has had a painful weeping rashes shown for 2 days. He underwent chemotherapy for non-Hodgkin lymphoma 1 year ago. His temperature is 36.7, pulse is 80 per minute, and the blood pressure is 138 by 76 mmHg. Examination shows no other abnormalities. Which of the following is the most likely diagnosis? Is it herpes zoster, impetigo, pyoderma gangrenosum, syphilis, or systemic lupus erythematosus? So it's a very easy question. If you're aware with the image, then without going through the clinical case, you can choose your diagnosis. But if you want to go with the image as well as the clinical manifestations given here, then certain points we need to remember that the patient has very painful weeping rashes for 2 days, acute presentation, pulse, blood pressure, everything is normal. So the main point here is multiple painful weeping rashes that are mostly vesicles. So number one point that will help you, that these are the crusting or the weeping rashes and vesicles. The distribution of such vesicles or such rashes is dermatome or the ophthalmic region. So if a distribution is like along the dermatome, that will also help you in diagnosing the condition. If you know the trigeminal neurons, there is ophthalmic division, maxillary division, and mandibular division. So it's mean the causative organism has some relationship with the neurons. Maybe they reside or rest or stay into the neuron, or they usually attack the neuron. So they have some relation with the nerve distribution. In this condition, the ophthalmic division is involved. So if multiple painful weeping rashes or vesicles along the dermatome, then the diagnosis will be shingles, or just we can say herpes zoster infection. So in this condition, the causative organism is herpes zoster and the condition is shingles. One more important point you need to remember related to that of the herpes zoster is that in this particular diagram, the nasal tip is sparing. But what happens if this infection spread to the nose and involve the tip of nose as well? Then that condition will be called as Hutchinson's nose. So if the involvement of nose or Hutchinson's nose is there, it means that the patient now has complication with the ophthalmic division, with the involvement of the eye as well. So that will be called as the ophthalmic shingles. But here you can say that there is the eye is somewhat normal, the vision is normal in this patient. But if the involvement of nose is there and Hutchinson's nose is positive, you need to think about the vision and the eye of the patient. So I will show you here in this image. You can see that the nose tip is also involved. Now look at the condition of the eye. Not only the external region of the eye, but that virus can also infect the internal ocular structures. So this is what we call as the Hutchinson nose, and involvement of the eye. So what about the other given options? What is impetigo? What is pyoderma gangrenosum? What is syphilis and systemic lupus erythematosus? I will show you some images. Look at this one. It is an infection, a bacterial infection, usually can see in child because of the streptococcal infection. It's a golden honey color crusting around the mouth or perioral region, usually seen in the child. So this is what we call as the impetigo. The second one is pyoderma gangrenosum. In this condition, you can see a large ulcer over the foot or over the shin, where a lot of pus because of the infection, ulceration with irregular borders. The cause is idiopathic, exact cause is unknown, but it has some relation with immune disorders. So this is what we call as the pyoderma gangrenosum. The next one is syphilis. So in case of primary syphilis, you can find such ulceration over the genitalia, and the feature of the primary syphilis is hard indurated ulcer which is painless, and usually it could be single. So single painless ulcer over the genitalia, more likely primary syphilis. Next one is the systemic lupus erythematosus. It's a multi-system disease, a connective tissue disorder, where we can see butterfly rashes over the face, sparing the nasolabial folds, maybe involvement of lungs leading to pleural effusion, heart problems like pericarditis, involvement of kidney leading to lupus nephritis, joints also affected, arthritis, and there will be Raynaud's phenomena. Some other features: photophobia, skin rashes, and other features also will be there. So this was the question of today. It is ophthalmic division, and the disease is shingles, and the causative organism is herpes zoster. So the treatment is acyclovir, can be given for the patient. Thank you very much.